Hi, this is Eshna Srigan. I am a healthcare professional specializes in quality and patient safety. Well, quality is a terminology which we oftenly use in hospitals and healthcare settings as a patient, as a visitor, and as a healthcare professional. But what do we actually mean by quality? Well, in order to understand the quality, we need to understand the basic concept, right? Now just imagine one of your relative is admitted to the hospital and nurse is supposed to administer the medicine as prescribed by the doctor. But unfortunately, the nurse administers the wrong medication due to which the patient dies. Well, this example perfectly illustrates the significance of quality in a healthcare setting. Quality is something which is very subjective in nature. Like for a patient or a visitor, quality means how the doctor's treatments are effective, how much the effective are doctor's treatment, or you can say how promptly their queries are being answered, the cleanliness of the hospital, the type of food provided to the patient. Well, quality from a doctor point of view might include the amount and the type of resources provided to them. Here resources means manpower, medical equipments, how easily can they retrieve the medical records of the patient electronically or through hard copies. Well, quality from a manager's point of view actually means how much the resources are optimally utilized, the reduction in the medical errors, and the better patient outcomes, right? So in a broad way we can say quality is actually doing the right thing at the right time. Well, as per National Patient Safety Foundation, quality is the degree to which a set of inherent characteristics fulfills a set of requirements. WHO, that is the World Health Organization, describes the quality of care as the extent of healthcare services provided to the individuals or to the patient population which helps them in improving the desired health outcome. As per WHO, in order to achieve this, the healthcare must be efficient, effective, timely, safe, equitable, and patient-centered. Well, I have got queries from a lot of students who are pursuing the hospital management. They often ask me that if I get placed in a quality department in hospital, then what will be our job profile? Since quality is very broad and very vast. So in order to understand this, we have to again start from the basics. Well, as we all know that each and every hospitals and healthcare settings, well, here I am actually repeating healthcare settings. But what do we mean by healthcare setting? Healthcare setting here includes daycare centers, clinics, nursing home. So each and every hospitals and healthcare settings actually have their standard policies and procedures which each and every hospital staff need to follow. Now here I have mentioned the term policy. What do we mean by policy? Policy is the guidelines which helps in decision making. Like in hospital we have registration policy, we have admission policy, we have discharge policy. Then what do we mean by procedure? Procedure is the specified way in which an activity or a process is carried out. Now then, what is process? Well, process is a set of interrelated or interactive activity which transforms the input into output. So in a general term, I can say policy is actually what to do, that forms the guidelines. Procedure is something which tells us how to do. That means it forms the entire process flow based on the guidelines. Well then, process is something which tells us how it happens, how the process flow results into the desired output, right? So, very important thing which we need to understand when I have described all these, the significance of the quality. Well, all these quality policies and procedures which we are making should be based on some national or international guidelines, right? Like at the national level we have NABH, at the international level we have JCI. In order to formulate infection control policies, we need to follow CDC guidelines. Okay, so as a quality professional, it is our duty to formulate these policies and procedure, as I told you before, based on certain guidelines. Once these policy and procedures are formed, now it is our duty to train the staff of the concerned departments in coordination with the departmental head. We have to train the staff, we have to train and retrain the staff and help them in implementing the policies and procedures, right? Once the policies and procedures are properly implemented, now our duty comes is to monitor whether they are being properly followed or not. So here we do the gap analysis. Now in case if we find the gap, we have to find out why this happened. We have to do the root cause analysis, and then we have to take the corrective measure, we have to take the preventive measure, so that the same incident does not happen again. So with this we can also say quality is actually the degree of adherence to the pre-established criteria or standard. Here pre-established criteria or standard are the policies which we have formulated based on certain guidelines, right? So quality in general is actually a continuous improvement process, because quality helps in the uniformity of process, it helps in the reduction in medical error, it helps in streamlining the processes, it actually results in the patient safety, which is actually our major and primary concern. Okay, so this is all about the quality. Well, in our next video we'll be discussing about the incident reporting, sentinel events, adverse event, what is near miss and what is no harm, right, and how it affects the hospital processes, right? So till then, thank you. This is Eshna Shrigyan signing off. If you like my video, kindly like it, subscribe my channel and press the notification button. Thank you.